Osteoarthritis is a process of wear and tear in joints which results in pain and stiffness. The joint surface, which is made up of cartilage, becomes damaged, and as it becomes rough, the joint doesn't move as smoothly, and as the thickness of cartilage is lost, it loses its shock absorbing property, so the joint becomes very sensitive to impact and exercise in particular. The causes are largely unknown. Most people have osteoarthritis. We can't really pin down exactly why it's developed, but we know that there is a genetic predisposition to it, and we also know that being overweight is quite a strong risk factor for osteoarthritis. The other common features are of a past history of joint injury, particularly during sports such as football or rugby at some point in the past. And often injuries tend to cause problems many years later, so at the time they may seem reasonably trivial, but 10, 20 years down the line they can come back to haunt people. The commonest symptoms of osteoarthritis are pain and stiffness. The pain often starts quite insidiously with initially just a bit of pain and stiffness after getting up, after sitting for any length of time. But then gradually this tends to become more severe, and people's walking distance often becomes very badly limited by it, and their ability to do other things like climb stairs can be limited by pain. Stiffness is very common around the hip. This tends to be noticed with difficulty of getting down to footwear, putting on socks or tying shoelaces, and around the knee it's noticeable people can't kneel down or squat down easily. There are other symptoms. Sometimes people get a lot of swelling in the knee, and other times, because the joint surfaces become quite rough and the joint becomes painful, people can experience instability, i.e. their knee gives way when they're walking or twisting. In terms of treatment for osteoarthritis, it's always appropriate to start with conservative measures, and by that I mean modifying your activities, so trying to avoid things that aggravate the joint in particular, such as impact, in particular jogging or walking long distances on hard surfaces. Physiotherapy is often very useful as well to build up muscles around the joint and to maintain your range of motion. And use of a stick can be very helpful to some people to help offload the joint. Simple painkillers such as paracetamol or ibuprofen are often very useful. And then moving on from there, we're really starting to talk about some form of surgical intervention. Injections of steroid can provide some temporary relief, but they're not definitive. Smaller procedures, keyhole procedures like arthroscopy of the knee, can be helpful to a degree if there's an associated tear of the footballer's cartilage, which can be corrected, but they're not really appropriate for people with severe arthritis because they've been shown not to make any significant difference. The definitive treatment for osteoarthritis of a joint is to replace the joint, and joint replacement has now become an extremely reliable and successful procedure with good results going out to over 30 years. Hip and knee replacements in particular become very successful in restoring function to people's joints, getting back to the activities that they enjoy. And that should always be the aim of a joint replacement. You want to get people back into the things that they love doing and make their life as full as possible. There are certain things that you can't do with the joint replacement because of the risk of wearing it out prematurely, so those are particularly impact sports, and particularly by that I mean things like running or football or rugby. We haven't really got a joint replacement that allows you to do that without risk. However, joint replacements are good for things like golf, possibly doubles tennis, and I have a number of patients who play badminton on hip and knee replacements. You need to be cautious with your joint, but at the same time the reason to replace a joint is to allow people to get back to a more normal lifestyle. It's difficult to completely eliminate any risk of osteoarthritis because a lot of the things that cause it are outside our control. Obviously any genetic predisposition is not going to be something that you can do anything about, but there are simple things like making sure that you keep your weight down in normal range and you take regular moderate exercise, which are very helpful to keep your muscle mass and keep you healthy, and these will reduce your risk of arthritis. In particular, we've seen that recreational activities such as running and so walking don't actually increase any risk of arthritis. You do need to be careful about any activity that might involve a risk of injury to your joint, and whilst accidents can't ever be prevented entirely, it makes sense to make sure that you're fit enough to play any sport and that you don't become excessively fatigued, and you take care to warm up your muscles and joints before you start to play. If you're suffering from pain in the joint, if it's short-lived, then it becomes difficult to know when to seek help. Certainly if you have recurrent pain, you should seek help from your GP, and if it's starting to interfere with your daily activities, then you should seek some form of professional help. If you have a very acute pain that stops you weight bearing or stops your knee or hip from moving, or if you have a lot of swelling in the joint, then you certainly should seek help earlier on.